How does obstructive sleep apnea affect overall health of the body? See, many people think snoring is harmless, but not every snoring is harmless. When snoring is associated with pauses in the breathing, which is called sleep apnea or obstructive sleep apnea, then it affects every cell of the body. How? See, obstructive sleep apnea is an inflammatory disorder. It will cause inflammation in the body, and because of that inflammation, every organ and every system in the body is affected. How does it affect heart? So when there is pause in the breathing, the oxygen drops. So this oxygen drop every night over a period of time and many times in the night, this causes lot of pressure on the heart. So when there is pressure on the heart, what will happen? The heartbeat changes, the rhythm of the heart changes, and because of that, there is high blood pressure. There is a study which says 50% of high blood pressure patients may have obstructive sleep apnea, and 50% of obstructive sleep apnea patients may have high blood pressure. Sometimes we have seen patients who are admitted for high blood pressure, which was not being controlled with other medication, and we took the case history. It was like the patient had sleep apnea. So over a period of time, if it keeps on happening, the pressure on the heart, irregular heartbeat, high blood pressure, so patient can have heart attack. How does it affect brain? See, if you have not slept in the night, there will be fogging of brain the next day, right? There will be drowsiness. Some patients, they say that we have headache. Oxygen deprivation of brain over a long period can cause memory loss also. Patients with obstructive sleep apnea, they lack focus, okay? They complain that we are not able to focus on the work because their brain is deprived of the oxygen supply. And because this is an inflammatory disorder, there are tendency for clot formation. And because of those clots, they can go and settle in the brain and can cause brain stroke also. GERD, gastroesophageal reflux disorder, or in layman terminology, it is called as acidity. Obstructive sleep apnea and acidity, they have a bidirectional relationship. Obstructive sleep apnea increases acidity, and increased acidity causes more obstructive sleep apnea. This is also related to the weight gain. See, when the patient is not able to sleep properly, their hunger hormones go out of balance. When the hunger hormones are not acting properly, so they will eat more, again the weight gain, more laziness, lethargy, daytime drowsiness, again the sleep apnea. So this cycle keeps going on in obese patients. So whenever the patient has obesity and snoring, they should definitely get evaluated and start the treatment for it. Over a period of time, because of high blood pressure and changes in the fluid volume in the night, the kidneys also start getting affected. So chronic kidney disease is quite common in patients with obstructive sleep apnea. Obstructive sleep apnea patients are more prone to have diabetes. Because of inflammation, there is increased insulin resistance. When the insulin sensitivity is decreased or resistance is increased, in those patients, ultimately the blood glucose level keeps on increasing. Diabetes and obstructive sleep apnea also have a bidirectional relationship. This is how every system of the body gets affected when you are not sleeping properly or you have obstructive sleep apnea. I would like to specify one more point here, especially in pediatric patient or children. Children who are diagnosed with ADHD, sometimes it is not actually ADHD. It is misdiagnosed because the child has obstructive sleep apnea and they get misdiagnosed as ADHD. So if your child has mouth breathing, snoring, he's sleeping like this only on one side, and there is pauses in the breathing, so please get it evaluated. If the child is diagnosed with ADHD, kindly get this evaluation also done to rule out any obstructive sleep apnea. So in the last, I would like to summarize, children may have poor performance in the school because of lack of oxygen to the brain in the night. The growth hormone secretion gets reduced, so that can affect the growth and development of the child. So in nutshell, I would like to summarize that every system of the body is affected when you don't sleep properly. So the message is sleep, eat, and exercise at the right time to maintain a healthy lifestyle.